Naturopathic medicine is based on a philosophy of medicine that has spanned hundreds of years, and it basically has the belief that the body has an innate ability to heal itself. And as naturopathic practitioners, what we look at is removing all of those obstacles to healing that may be in the diet and the lifestyle or to do with disease. And we use herbal medicine and nutritional medicine and also homeopathic medicine as treatments for that. It involves a lot of science study because we study a lot of the Western sciences, so anatomy and physiology and chemistry and pathology and symptomatology, and around that we study nutritional medicine and herbal medicine, and also you can do massage or homeopathy as electives within that. So it's quite an intensive course, and there are a lot of communication subjects and counselling subjects and some philosophy subjects around that as well.
I was really drawn because it was so fascinating. I loved herbs, and as I was learning about them, finding out what they could do, it also gives people the power to look after themselves. A lot of medical problems can be resolved with good nutrition, good diet, and maybe some herbal medicines. It's a really interesting career. There are different careers that come from it. One is, of course, being, as I am, in a clinic as a naturopath seeing people. A lot of people work in health food shops where they can give advice to a lot of people who go through. There are jobs with the different companies who produce different nutritional supplements and that sort of thing. A lot of people go into further academic research or into places like the Department of Health or the Therapeutic Goods Administration.
What makes a good naturopath? Okay, being a people person, I think you have to have compassion and real concern and care for people. You have to have a strong knowledge base, and you also need to inspire people and motivate people, and you need to be an educator as well, because a lot of what we impart to people in naturopathic medicine requires a lot of education and explanation and a lot of inspiration and motivation for them to change their lives.
Pathology specimen collection gives students the required qualification to work in a specimen collection practice, which may be in a large hospital or in a specific isolated location. The whole aim of the course is to enable you to work effectively in a pathology specimen collection area, measuring lung capacities, lung volumes. You're taking samples from almost any part of the body and preparing those samples to be sent away to be tested. So the subjects you'd be doing are things like medical terminology, occupational health and safety. You learn about client care and quite a bit of anatomy and physiology, and then we do an ECG, electrocardiograph, separate qualification, and we also obviously spend a lot of time learning how to take blood samples. Some of our students have also combined this course with an advanced diploma in pathology specimen testing, and they find that that gives them more opportunities in employment. There is always a job for people who can take blood samples. A good person in this field would be somebody who has really good skills dealing with people who are perhaps frightened, so a lot of interpersonal skills, and a very good grasp of protocol and appropriate behaviour, because after all they are dealing with potentially dangerous situations of taking other people's blood.
Okay, the course went over a period of about 2 years, and it involved learning how to do the practical side of the shiatsu massage and traditional Chinese massage, remedial massage, but also investigated the principles behind those two techniques and theory about traditional Chinese medicine.
I think the most interesting thing about this field is that when you start learning about traditional Chinese medicine, you have to adopt a different way of looking at life. So you're actually incorporating a whole lot of different concepts from another culture. You know, you have the normal ideas like yin and yang, concepts of balance, the flow of energy through channels, how emotions and attitudes are inextricably tied up with everyday health. And the students tend to find that pretty interesting too, and they enjoy that.
Well, when I finish my course, I have a choice to go into as a Tuina massage therapist, or I can choose to become a shiatsu therapist.
Someone that can assess their client quite well can draw a lot of information from their client and get them to give you information about how they're feeling, what their condition is. Someone who's willing to listen as they go. You have to be able to judge your client well. Some people like to just lie on the table and be massaged. I don't like a lot of chatter. Other people chat all the way through. So you've got to be able to read your client quite well. A lot of people like information about the services they're getting as well. So they like more than just a massage. So they like general health information, and you need to be able to judge that.
They'll be learning how to mix dental materials, or the materials that they'll be using in the practice. They'd be looking at practical chairside skills, infection control, which is a majority of the course. We look at the process of caries or dental disease and how it can be prevented. We also look at specialist subjects such as oral surgery, endodontics, prosthodontics. It covers a range of subjects, both theory and practical, so that you get the practical skills to do what you're doing every day. If you're looking at furthering your career path, and dental assisting is a career, it's not just a job, it's a profession, it's a good start. It gives you the basics. You can go on to do a certificate 4 level. Then we've had students interested in going on to do hygiene or therapy, and also we've had students interested in actually taking on the dentistry, the Bachelor of Dental Science.
Once I finish my dental assisting course, then I can move on to anything like radiography or becoming a dentist or anything else like that. And once you're qualified, you can go anywhere with that job.
A good dental assisting student is one who enjoys their work, because you need to be doing the communication with patients, and you're dealing in an intimidating area. People are frightened going into a dental environment. So you need to be empathetic, need to be willing to learn the background of what you're doing every day, which is the theory side of the course.
The Allied Health Assistance course covers physiotherapy assistance, occupational therapy assistance and speech pathology assistance. When you enrol in the Allied Health Assistance course, you'll be choosing a pathway, whether that be physiotherapy, occupational therapy or speech pathology as an assistant. And within those subject areas, initially you'll be doing subjects together with all the Allied Health Assistants, subjects such as occupational health and safety, looking at aged care and rehabilitation, general working with clients and communicating with clients. And in the second part of the course, we then move on to more specialised subjects where each of those streams would be covering areas that are specific to them. And that might then break up into areas such as anatomy of the head and neck for speech pathology, and more broad anatomy for physio and occupational therapy. Also looking at more particular areas of employment for those particular streams. The course is interesting because it really does have a range of different ways of accessing information. For instance, with subjects such as anatomy, it's quite hands-on. We're looking at models and really getting a really good feel for that area. In other parts of the course, it's project work, group work. There's obviously the clinical placements or observational placements where you're going out and seeing what other health professionals do, and later in the course actually going out and being part of that in your industry placement, actually going out and seeing clients yourself. So the course is quite varied. It's not just a lecture style course. There's quite a lot of practical input where you're actually learning to use equipment, learning about what you might need to use as an allied health assistant. It's important to have a caring attitude to other people and to be interested in other people, because you're going to be employed within the health sector or within the disability sector. A lot of allied health assistants in Australia are employed with aged care, and also within that disability sector with small children or with adults who've had acquired brain injury or other disorders that means that they need ongoing assistance. So it's very much a caring profession.
learning many complex techniques, such as the remedial massage, trigger point therapy, and myofascial release, lymph drainage, and just relaxation in general.
I find that I use a lot of stories about what's happened in my practice to actually help them relate the material that we're learning back to what we're actually doing in class to make it more relevant. We're actually using video at the moment to engage them, so they get to do the video, see themselves on video as well as see the techniques on video to help with revision. I suppose what I really like is the aspect of helping people and being able to make changes in people's lives, whether it's a small change of getting them to breathe more or drink more water, or if it's getting them out of pain.
I've just always been interested in the body and how it works and how I can fix it.
I see myself specialising in pregnancy massage and infant massage. I'd like to own my own clinic. I think there's an endless opportunities working as a massage therapist here in Canberra. You'll never be without a job.
I just finished my course in June this year and now I'm managing a clinic here in Canberra. So basically what I do is I treat half a day, I see clients for half a day, and then the rest of the day is I run the clinic.
After I finish this, I'm not really sure, might want to get a job as a massage therapist just in general, use it as a stepping stone to uni and become a physio.
You need to be people friendly, I think. You need to be able to feel approachable. I think you do have to have a sense of warmth about you and caring, but there's also the other side of it where you do need to know your research, you do need to follow up, and you do need to talk to doctors, and there's just so many different aspects of the job which makes a really good therapist.
We have all different types of students going from school leavers. We get a lot of people who want to get into sports massage, so the young fitness type people, as well as we get people coming back after being out of the workforce for quite a while or changing careers, so they might be full-time in the public service, take a year off to come and learn how to do massage and then change their career and go into the field of massage.